Time now for our regular doc spot. Today, Dr. Abayomi McEwen is here to talk about the post-viral syndrome, or ME. She will tell us its full name in a moment because I can't. It's estimated there are about 100,000 sufferers in Britain, yet many doctors are reluctant to recognise the illness. Abi, good morning to you.
Good morning.
The full name, ME, can you do it for me?
It's myalgic encephalomyelitis.
I thought it was, but I wasn't going to trust myself. Explain it for me. What is it?
Well, it's been given lots of names: post-viral fatigue syndrome, yuppie flu, and this is because nobody's actually sure exactly what it is or exactly what causes it. And really, it is a complex of symptoms of being tired after mild to moderate exercise, whereas before people could run 3 miles. Just walking up the stairs exhausts them and takes them 2 or 3 days to get over. Loss of memory, finding it difficult to concentrate, and generally being out of sorts. And it's often related to a viral illness, like having flu or a sore throat or something like that, and just not recovering.
It can initially, and very often is, diagnosed first as glandular fever, isn't it?
It can be, although there is a specific test for blood test for glandular fever, which, if done at the right time in the course of the illness, shows that it's definitely glandular fever, but it's quite similar in its behaviour to glandular fever in that there is fatigue. But glandular fever, the glands are swollen all over the body, whereas with ME, this is not necessarily so.
Are doctors beginning to recognise that it actually exists now, this problem, ME?
I think an increasing number of doctors are accepting it as a diagnosis, particularly when they see that they often used to think people were malingering. But when one sees people who are normally, you hardly ever see in the surgery, who work very hard, who really have no reason to malinger, and who are very frustrated by their illness, one has to accept that there must be something physical going on.
Claire Francis, who's sailed around the world on her own, the yachtswoman, she suffered.
That's right.
She got this, an awful lot of publicity by banging a few doors and making people sit up and take notice.
That's right. And unfortunately, this is what patients still have to do if they're dealing with parts of the medical...
Should they have to, though?
No, they shouldn't have to, but again, doctors are free agents like everybody else. There are lots of areas of medicine that are controversial. There are lots of treatments that are controversial in various areas of medicine. People are very dedicated to certain lines of thinking. And as research goes on, the important thing is to carry out lots of research to actually get hard facts about the cause and any possible form of treatment.
Were you an early convert?
Yes, I was, because I trained at the Royal Free Hospital, and it was first described in London, and it was first described in this country at the Royal Free Hospital in 1955 when there was an epidemic of it amongst members of staff, and it was first classed as mass hysteria. But one of my consultants, with whom I worked in my early days, actually said he had had it, and I was very interested and read up about it, and so I was an early convert.
Look, if you've got it, you probably know that that's the case. You've then got to start convincing people that that's in fact the case. If your GP's a little sceptical, what's the best advice you can offer?
Well, I think either, get information. Some patients have brought me information to read, and I've learnt a lot from my patients about it. There are lots of, there's the ME Society, and there's the other one which Claire Francis founded, the Campaign for ME, I think, which give lots of information packs.
Is it worth looking around, maybe talking to another doctor about it?
It's
if you're
worth
unconvinced?
Certainly looking around and getting advice, and there are a lot of the alternative medicinal approaches which help people, and I think they work basically by giving people basic sensible advice about diet and lifestyle. I believe that a lot of our illnesses are caused by the stress of modern living, and when something like this hits somebody, they stop and they think, and they realise their body is not a machine that can be abused and kept going, and they begin to look after themselves and really consider how they're eating, how they're resting, what their stresses are, and I think that makes as much difference as anything else.
Abi, thanks for that. It's been a problem, but people are beginning to recognise it, thank goodness. Thank you, Abayomi McEwen. And let's go and find out what's happening on the weather front.